Why are a lot of people searching for IRBBB? People are searching for IRBBB primarily because of a collision between modern technology and scary sounding medical terminology. More people are getting routine electrocardiograms than ever before, whether through wearable devices like smartwatches, corporate health checkups, or routine physicals. When a patient checks their automated ECG readout or their online health portal and sees the words incomplete block, it understandably triggers a frantic internet search. IRBBB stands for incomplete right bundle branch block. Despite how alarming it sounds, in the vast majority of people, especially the young, healthy, and athletic, it is a completely normal, benign quirk of the heart's electrical system, not a disease. To understand what it means, it helps to look at how the heart beats. The spark, an electrical signal, starts in the top right chamber of the heart and travels down to the bottom pumping chambers, the ventricles. The pathways. The signal travels down two main electrical highways to tell the ventricles to squeeze simultaneously, the right bundle branch and the left bundle branch. The block. In an IRBBB, the signal traveling down the right bundle branch is just slightly delayed compared to the left. Instead of taking the normal amount of time, under 100 milliseconds, for the electrical signal to sweep through the ventricles, it takes between 100 to 110 milliseconds. The signal still gets there and the heart still pumps effectively. The right side is just a tiny fraction of a second late. IRBBB is incredibly prevalent. It can be caused by natural physical shape of a person's heart, normal aging. Up to 11% of people have a right bundle branch block by age 80, or simply having a physically fit heart. Endurance athletes frequently show this pattern because exercise-induced remodeling of the heart or higher vagal tone slightly alters the electrical conduction. While a doctor will investigate further if the IRBBB is accompanied by symptoms like chest pain, fainting, shortness of breath, or known underlying heart disease, an isolated finding of IRBBB on an otherwise healthy person's ECG usually requires zero treatment or lifestyle changes.